Thank you very much for this opportunity. My presentation is on our 10-year single-center retrospective review of surgical outcomes in low and intermediate risk neuroblastoma. I have nothing to disclose. Low and intermediate risk neuroblastomas have excellent outcomes. Overall, an event-free survival has been reported as greater than 90%. Image-defined risk factors are used to estimate surgical risk and are used to select suitable surgical candidates. The aim of our study was to evaluate the impact of initial management in outcomes for low and intermediate risk neuroblastoma. We performed a retrospective review over a 10-year period. Our primary outcomes over a 5-year follow-up included overall survival and event-free survival. We had a total of 43 patients, 24 boys and 19 girls. Overall, median age at diagnosis was 5 months, and you can see the age distribution over the various risk categories. Primary site for tumour has been displayed in the table in the top right. I further demonstrated the subdivisions of risks and number of patients. So in the 43 patients in our study, we performed a total of 28 operations, and there were 3 treatment arms that patients were divided into: primary observation, primary surgery, and primary chemotherapy. We had 10 low-risk patients in the primary observation group, 2 of which required further chemotherapy alone. 1 went on to have surgical excision alone, and 1 required a combination of chemotherapy and surgery. There was 1 death in this group. Primary surgery was performed in 12 low-risk neuroblastomas, of which there were 6 observed postoperative complications. All were disease-free at the end of the follow-up period. In the intermediate category, there were 4 patients who underwent primary surgery, of which we had 3 postoperative complications. Again, all were disease-free at follow-up. A total of 17 patients had initial chemotherapy. Of these, 10 patients went on to have surgical excision. And of this group, there were 3 observed postoperative complications. There was 1 death within this category. Our overall survival rate was 95%, and our event-free survival rate was 72%. Overall, we observed a 43% postoperative complication rate within our cohort. Within the primary surgical excision group, 56% postoperative complications were observed. Within the group who had surgery following chemotherapy, a 30% complication rate was seen. The table demonstrates both short and long-term complications that had occurred in this cohort. The low-risk neuroblastomas were almost equally divided into the 3 primary treatment arms. 1 patient with primary surgical excision required additional chemotherapy. Within the intermediate risk neuroblastoma, 36% underwent primary surgical excision. 1 patient required additional medical therapy. Overall, 65% of patients underwent surgery. 37% of patients had primary surgical excision within this cohort. So in conclusion, surgery has a significant prognostic role in the management of neuroblastomas. Our study demonstrated a higher rate of surgical morbidity in patients offered primary surgical excision in low and intermediate risk neuroblastomas at a rate of 56%. Thank you.